Studying the subject of ophthalmology is quite interesting. We're studying basically the conjugate organs. We have a pair of eyeballs and they're working in a conjugate pattern. So studying them are very interesting in a lot of cases, and one should know how to examine the eye in the patients that come to the ocular OPDs to us. So the eye examination procedure will be discussed in this section, and we'll be then moving on. In this section, we'll be just focusing on the steps of the eye examination. Obviously, when we say that we're going to start off with the eye examination in a patient, the examination starts off from the inspection of the eye. So what are you going to notice when you have a patient at your hand and you're going to inspect the eye? It can start off from the eyebrows and then the eyelids, and then we're going to move on to the conjunctiva, the cornea, the pupils. So any abnormalities that are related to these organs can be noted down or can be documented by the ophthalmologist. It can be the eyelashes or any abnormality indicating an inflammation, an infection, or any abnormality or a disease that it requires a surgical procedure can also be noted down by the physician or by the ophthalmologist. So we have to document all these findings in detail when you're going to write down the examination of the eye. The inspection is the first and the primary step of the examination over here. Then we're going to move on to the important landmarks of the eye over here in this section. When you're going to inspect an eye, one should know what are the important landmarks of the eye or of this organ. It's again very important to know the organs that are in the vicinity, and that can correlate to the eye diseases. For example, the orbital cavity is going to communicate with the nasal cavity, and then the orbital cavity can also communicate with the anterior cranial fossa. So infections from the eye can travel to the anterior cranial fossa, and we'll be discussing the orbital anatomy or the anatomy of the orbital cavity over here. What is the communicating structure between the orbital cavity and the anterior cranial fossa? It's basically a cribriform plate, and through this the infections can travel from the nasal cavity to the anterior cranial fossa, and then on the other hand it can also travel from the orbital cavity to the anterior cranial fossa. So these are the communications that we're going to discuss over here in this section. And anatomy, or knowing the anatomy of the eye and knowing the landmarks of the eye, is again the mainstay when you start off with the examination of the eye. So this will be the main focus of this section over here. So when we discuss the eye examination, there are these particular steps of the eye examination, starting off with the visual acuity. So these are the particular examinations that can be carried out depending upon the complaints or the presenting complaints of the patient that the patient is going to come up with in the ocular OPD. So if he's complaining that his range of vision or if his clarity of vision is not up to the mark, then you're going to examine that particular patient for the visual acuity. So visual acuity is usually examined through a chart which is present in the clinics of an ophthalmologist, basically known as the Snellen's chart. So Snellen's chart is basically the handful for the, it's a tool basically for the examination of the visual acuity in these patients. You basically ask the patient to stand at the distance of 6 meters, and there are these bold letters which are known as the optotypes that are printed on the Snellen's chart. So that is going to indicate the level of the visual acuity in that particular patient that we're talking about. Then the next step can be the color vision. So one of the problems that we usually come across is the color vision, and that again is carried out by the Ishihara's charts that are present in the clinics of the ophthalmologists again, and that is for the identification of the different color vision abnormalities that can be present in the person or in the patient. For example, it can be the red-green differentiation problems in a particular patient. So we're going to identify these problems in these patients when we are going to examine them accordingly. Then we can have problems of the visual fields. Now, visual fields are sometimes quite tricky when we have them at our hand. It can be a neuronal problem, that is basically the interpretation of the brain is affected, or it can be any problem with the particular anatomical features of the eye. It can be the cornea, it can be pupils that can basically relate to the problems of the visual fields. Visual fields are usually divided into the temporal fields, and then we have the nasal fields. So depending upon which field is affected, we're going to document which field is affected and whether it's going to be the central vision which is affected or whether it is the peripheral vision which is affected in these cases. Then we have the pupils at our hand. So pupil is basically an apertural opening in the iris or in the muscular iris, and sometimes we have abnormalities that are related or that are quite specific to these pupils. So one should know what can be the abnormalities over here with these pupils. It can be the congenital abnormalities, it can be the traumatic abnormalities, and one should know how to deal with them. There are a lot of treatments ranging from the surgical treatments or the pharmacological interventions that can be carried out in this particular patient that we're talking about. So first of all, we're going to start off with the inspection of the patient. The visual acuity is carried out, and then the examination for the visual fields is carried out, and then we have the pupillary responses, which also includes the light reflex responses over here. And then we have the fundoscopic examination, which is carried out with the help of an ophthalmoscope over here. Over here, you can see that the examination is being carried out, and this is known as a slit lamp examination, which is usually carried out in the ophthalmologist clinics or with the optometrist as well. So here, the ophthalmologist or the optometrist is basically determining the visual acuity, is putting out the different lenses, and he's basically examining or determining the clarity of the vision in the patient over here. So first of all, as I've already talked about the inspection of the eye, it's again a very important feature. First of all, you're going to carry out the external ocular structure inspection. That includes the lids, and that also includes the conjunctiva. We have the iris, we have the cornea, and the pupils at the other hand. So these are the structures that have to be examined in details for any abnormality or for any diseases that can be found in these structures. Then we can gently move the eyelids up or down. Then we can examine these organs in detail. To obtain a better view, it's again very important to examine these patients and make them sit on the slit lamp, because it has the particular light and focus that can be carried out when you make the patient sit on the slit lamp, and that is how the inspection is usually carried out in the OPDs or the outpatient departments as an ophthalmologist, if you're working as an ophthalmologist. Now, what is the important landmarks of the eyes that can be noted down when you're working as a physician? It can be the eyebrows, and then we can have the problems with the upper eyelid. So any problems, for example, a sty formation or the chalazion, can be found on this upper eyelid as well. And then we can have the plica semilunaris over here. So it's basically a punctal opening for the lacrimal gland or the nasolacrimal duct that is present on the plica semilunaris over here. We have the lacrimal caniculum over here, and then we have the lacrimal papilla over here. So this is basically the pupillary opening or the pupillary aperture that I was talking about, and it's basically present inside the iris. So it's basically this muscle. It's one of the intrinsic muscles that is present in the eye, and it has an aperture which is known as the pupil. And then we have the lower eyelids. Lower eyelids have the same problems as per the upper eyelids. It can be the sty formation, it can be the chalazion formation, and it can be any problems with the eyelashes. For example, if any ducts that are present over here, ranging from the meibomian glands, the openings for the meibomian glands can be blocked, and it's again going to present as a stye or as an inflammation of the meibomian glands over here. Then there is the sclera. It's basically the protective covering of the eyeball, and we can have many problems that are related to the sclera. It can be an inflammation and infection, and all of these can be related to the eye problems or to the diseases that we can encounter when we are examining the eye in a patient. So on inspection, you're going to see the structures to inspect, and the position and the alignment of the eyes is also going to be inspected. If the patient has some sort of squint or the strabismus is observed in that patient, we're going to see what is the level of the squint or the strabismus in that particular patient. Then we're going to inspect the eyebrows in this particular patient. The eyelids are going to be inspected, and then the lacrimal apparatus is also going to be inspected in detail. So in this section, basically, we primarily started off with the inspection of the eye, and how are we going to start off with documenting the different diseases that are quite prevalent with the eyeball. So that is the end of this section. Thank you for watching sqadia.com.